There are new concerns about one of the biggest taxes under Obamacare, why it could directly affect the cost of your premium.
New concerns of inflated premiums under Obamacare. Yesterday marked the first day of coverage for millions of people, but it also marked the start of a new annual fee for health insurers. They are projected to pay $8 billion in fees this year, $100 billion over the next decade. And costs like that will likely be passed on to consumers. Steve Moore is a Fox News contributor. Thanks for joining us.
Hi, Patty Ann.
What's the impact on families here?
You know, this was supposed to be a tax on those big bad insurance companies, right, Patty Ann? But almost all of the economic analysis that has been done of this tax, including the Congressional Budget Office, says that the cost of that tax will be passed on to families and small businesses. And so it's going to take a bite out of people's incomes. Now, the first year, this year, won't be very significant, about $100 per plan. But over time, as the tax increases, we're talking about $500 a year. So this is a very significant tax. And let me just add one other thing about this, Patty Ann. The whole idea and mission of Obamacare is to get more people covered with health insurance. I never could understand, as an economist, the concept of taxing health insurance plans, making them more expensive, if you want people to be able to afford health insurance.
Yeah, and as you mentioned, the impact on business, those costs get passed on to workers and eventually onto consumers. But also with small businesses, though, most union plans are exempt.
Yeah. Interesting, isn't it, that most union plans and most government plans are not subject to this tax. And I've talked to a lot of people representing small businesses, and they say, wait a minute, this isn't fair. Why is it the small employers that hire, 30 or 40 or 50 people have to pay a tax when the big businesses and the union plans don't? So there's a real kind of unfairness issue here that is making employers very, very angry. And don't forget, we also have a problem that a lot of employers are looking at possibly dropping their health plans starting next year because of the employer mandate that kicks in January. This health insurance tax, Patty Ann, only increases the incentives for businesses to drop their health plans altogether.
Well, the health insurance industry has been lobbying hard against this from the beginning, and there is now a bill in Congress to repeal it. 229 co-sponsors. Do you think it will happen?
There is a big push, you're exactly right, in the House and the Senate to get rid of this tax. But guess who doesn't want to get rid of this tax? The president. The president has really pulled in his heels and said, we are going to stick with this tax. It's a primary way to finance Obamacare. So you could see another big showdown between Congress and the president on this health insurance tax later this year. But I don't see any give from the president on imposing this tax, and I don't think he's going to want to relax it one iota.
Well, if it does get repealed, again, when you pull out certain elements of this plan, does it work without that extra revenue? There's, a lot of working pieces here.
Great question. And look, my view is, and I've really analyzed the fiscal costs of Obamacare. I don't think any of the numbers add up, quite frankly, Patty Ann. So this would be another, if they got rid of this tax, they'd have to fill this hole. And as we know, a lot of people aren't signing up for Obamacare, so those premiums that the government was hoping to collect aren't going to come in near what people thought. So the bottom line here is, remember that promise that this won't cost the federal treasury a dime and that it will reduce the deficit. Those projections are looking mighty wrong, and it's looking right now like Obamacare, in addition to all of the other problems in terms of getting this thing rolled out, I think you could see a major impact on the deficit of Obamacare in the years to come.
All right, Steve Moore, thanks as always.
Happy New Year.